I'm Evelyn, and I'm going to be doing a barium enema today, and I'm going to be demonstrating how to do it. So first I'm going to begin with setting up my room, which is getting all my supplies together. So first I'm going to get my barium enema kit, which I have here. It comes with a barium enema bag, which has barium in it. I've already put water in it. You put about 500 milliliters of room temperature water in it, and then you shake it for about 30 seconds. Then it comes with hemostats, it comes with the enema tip, it comes with the cuff inflator, the air infuser, the jelly, gloves, you need towels, and then you're going to need a patient gown. And one of the first things you want to do is you want to bleed the line, which I've kind of already done, and that just basically takes all of the air out of the tubing. And then next I'm just going to go get my patient. I'm Evelyn, and I'm going to be doing a barium enema on you today. Can I get you to confirm your first and last name and your date of birth?
Miriam Sandoval, October 11, 1980.
Okay, and before we get started, is there any chance that you could be pregnant?
No.
Okay, and what brings you in today? Why are you having this procedure done?
Constipation.
And how long have you been experiencing that?
For like 2 months.
Okay. And do you know the procedure that's being done today, a barium enema? Have you ever had it done before? No. Okay. Do you have any allergies, or have you had any contrast before?
No.
Okay, so this procedure, it involves barium and air. It's going to be put into your colon, and how the radiologist does it is he uses a catheter tip, which is right over here. We insert it into your rectum, and you're going to feel a little bit of pressure, a little bit of discomfort, but we'll get through it together. Just let me know how you're feeling as the procedure is going on. And before we get started, I also need to get a consent form from you. I just need you to sign this, just saying that you are aware of what procedure is being done, also the risks involved, which are if basically after this you have to drink a lot of water, because if you don't get the barium out of your system, it could make you more constipated, which we don't want. So now we're going to go ahead and get started with the procedure. Okay, so now we're going to start out with the scout image. Before we get started, I just wanted to make sure that before we start with the barium, that you follow the diet that you were supposed to be following for the past 2 days, low residue diet, use of the enema, laxatives. Okay, so we're going to get started with the KB. I'm going to shield you. My tube is already detented to the table, and then I'm going to put my film in, which is a 14 by 17. My marker on. My tube is at 40 inches, and then my centering is at the iliac crest. And so now I'm just going to give you some breathing instructions. And before I do that, I'm going to say my technique, which is 80 at 32. So go ahead and take a deep breath in and blow it out and hold. Beat. Okay, breathe and relax. Now I'm going to run my film. Now I'm going to go show it to the radiologist. Okay, so I've shown the image to the radiologist. Everything looks good, so we're good to go. So now I'm going to tip the patient. So now what I need you to do is I need you to roll onto your left side. And you're going to bend both of your knees. Your right leg is going to go slightly over your left leg. And so I made sure that the bag is hanging so that it's no more than 24 inches above the anus. I've got my jelly out right here, and I'm going to just make sure that I put some on the tip of the catheter just so it's comfortable for the patient. So I'm getting ready to tip, so go ahead and just take in a deep breath. I'm going to make sure and insert it no more than 3.5 to 4 inches. And there's two anterior posterior curves of the anal canal, so you want to go up towards the belly button and then down again towards the rectum. Okay, so taking a deep breath, and I'm inserting it. Okay, and it's in, so now what I want to do is I want to inflate the cuff. And I'm going to take the hemostat just to make sure that it stays inflated. And now we're going to get the radiologist, and he's going to do the fluoro. Okay, so now the radiologist has finished doing all the fluoro, so now I'm going to do all of my overheads. So I'm going to start with the PA. I'm going to do it on a 14 by 17. This is just basically a KB. So you do it at 40 inches. Make sure that the tube is aligned with the film. Put my marker on. Left side since it's PA. And then I'm going to center at the level of the iliac crest. And I'm going to shield. And this time there's some barium in there, so I'm going to go up on my technique a little bit. So it's going to be 110 at 40 this time. So go ahead and just hold your breath. Boop. Okay, so I've taken the image. Go ahead and breathe and relax. So I'm going to take this out. I'm going to run it. Beep. Okay, so now I'm going to proceed to do my obliques. So now I'm going to start with my RAO, since she's already on her stomach. My marker on there again, and I'm still at 40 inches for this. So, and I'm gonna keep shielding her. And for my RAO, what I want to do is it's going to be at the level of the iliac crest still, but this time it's going to be 1 to 2 inches lateral from the middle of her body. So that's about right here, so I'm going to move the table a little bit. That looks good. And so what I'm going to have you do is just hold your breath. Breathe. So for this, the technique is going to be up again. It's still going to be 110 at 40. So hold your breath. Beat. Breathe. Okay, so I've taken the image. I'm going to go run my image. Ooh. Okay, so now I'm going to do my LAO. Put my marker on there again, and it's still at a 40 SID. The technique is going to be the same as the RAO, which is 110 at 40. You're up because of the barium in the colon. Okay, so now what I need you to do is to go onto your left side and elevate your right side. There you go. You're going to bend your right leg. That's perfect. And then same thing as the other oblique. What you want to do is level at the iliac crest, and you're going to go 1 to 2 inches lateral from the mid-sagittal plane. Okay. So again, go ahead and hold your breath. Beat and breathe and relax. Okay, so now I'm going to run my image. Okay, so now what we're going to do is we're going to do the PA axial, and this is to show this sigmoid colon. And since it's PA, the angle is caudal and it's 30 to 40 degrees. I've brought down my tube a little bit just because when it's axial, you need it to come down lower so that you can make sure it remains at 40 inches. I've aligned it with, I've aligned my my film tube, and I put my marker on. And the centering for that, you want to do it at the as is. So I'm going to move the table a little bit. Make sure she's still shielded. And also, since it's the sigmoid, the film is smaller, it's 10 by 12, and my technique for this is going to be about 100 at 32. So go ahead and hold your breath. Beat. Okay, breathe. Now I'm going to run my film.
3.
Okay, so now we're going to do our cross table lateral for the rectum. And so I have a 14 by 17, but you just column it down to about a 10 by 10, and I'm using a grid with this. So my technique for this is going to be about 110 at 50. And you want to center at the as is. I'm just going to column it just so I get just only the area I need. And I'm going to go ahead and mark this. Okay, and hold your breath. Beat. Okay, breathe and relax. And I'll take this from you. And I'll go run my film. Beep. Okay, I've ran my film, and so now I'm going to come back and I'm going to set up for my cross table decubes. So now what I'd like you to do is to roll onto your left side. And I'm just going to make sure that she doesn't get too tangled with all the tubing, just to make sure that she's still comfortable. And I'm going to put this against your stomach, and I just need you to kind of hold it in place for me. There you go. Okay, so now what I'm going to do is I'm going to center at the level of the iliac crest, and I'm going to put my marker on here. And for the cubes, you want to still be high up with your kg and mass. And so it's going to be about 110 at 50. I'm just going to make sure that I have all the collimation that I need. Okay, so go ahead and just hold your breath. Beep. Okay, breathe and relax. And I'll take that from you. And now I'm going to go run my film. Beep. Okay, so now what we want to do is we want to do the right lateral decube. So I'm going to have you do is I'm going to have you roll onto your right side. Okay. So this is going to go behind you. Okay, and again, this is going to be at the level of the iliac crest. I'm going to put my marker on there. And my technique for this is going to be the same, 110 at 50. Just making sure I'm collimated correctly. I'm going to make sure the shield is on there properly. And go ahead and hold your breath. Beat. Okay, breathe and relax. And now I'm going to run the film. Beat. Okay, so I've ran the film. And now we're done with all of our overheads. So now I'm going to go ahead and I'm going to take out the enema tip. And so what I'm going to do first is I need to undo the cuff and get some towels ready. And I just need to warn the patient first. So I'm going to go ahead and undo the balloon, and then I'm going to take out the enema tip, and there's a towel behind you. So you can just go ahead afterwards, go to the restroom and expel all the barium that's in your colon. Okay, so I've undone the cuff, and now I'm going to take out the tip. Deep breath. Okay, there's towels behind you. And now you can go to the restroom, and then we'll do your post-evac image. Okay, so now we're ready for our last image. The patient has evacuated all of the barium from her colon, and so now we're going to do a last abdomen x-ray at KUB just to see, to make sure everything is out. So I'm going to use a 14 by 17 for this. I'm going to put my marker on there. My x-ray tube is already decanted, and it's lined up with my film. And my KV for this is going to be about 110 at 40. So now what I'm going to do is I'm going to center at the level of the iliac crest. Okay, and now what I need you to do is I just need you to go ahead and take in a deep breath and blow it out and hold it all out. Beat. Okay, breathe and relax. Okay, I'm taking my image. Now I'm going to go around it. Okay, now I've ran my image. So now we're all done here. So you can go ahead and sit up. I'll take the shield from you. And before you leave today, I just wanted to give you some instructions. What you need to do is you need to make sure that you drink a lot of water to clear everything out. Just because if you don't get it out of your system, it could make you more constipated. We don't want that. Also, you're probably going to have some discoloration of your stool. It's probably going to be light in color. That's just the barium. That's normal. And that's it. Okay, so now I'm going to go over my radiographs. So the first one is the scout image. This is a KUB, and this is done before the barium is inserted into the colon. This is done just to make sure that the colon has been cleansed, no fecal matter, so that no false positives come up on the radiograph. So my second radiograph is of the PA, and as you can see, there's barium and air already in the colon. This is done to visualize all of the colon. Okay, so this is my next image. This is the PA axial, and this is done to visualize the sigmoid colon, just down here. Because if you do just a regular PA, the view of the sigmoid is obstructed. My next image is one of the obliques. This one is the RAO, and this position is used with barium and air to visualize the right colic flexure, which is up here. Also the ascending colon, which is right here, and also the sigmoid down here. So my next one is of the other oblique, which is the aleo. This one is done to visualize the left colic flexure up over here. So you can see that, and also the descending, which is down here. Now I'm going to move on to the decubes. This one is the right lateral decube, and this is used to visualize the medial side of the ascending, which is down here, and the lateral side of the descending. This is my next decube. This is the left lateral decubitus. This is used to show the lateral side of the ascending, which is up here at this time, and also the medial side of the descending down here. Now this is the lateral projection of the rectum, and this is used to visualize the rectum. Okay, so this last image is of the post-evac. This is basically a KUB, and this is done after the patient has already had the catheter removed, and they've been sent to the bathroom to expel all the barium that they can. And this is done so that you can see that they have properly disposed of the adequate amount of barium. An abnormality that could come up on a radiograph on a barium enema procedure is a polyp, which is visualized here where the arrows are. That's basically a growth or a mass, and it's going into the intestine. Another abnormality that could come up during a barium enema exam is if the patient hasn't properly cleansed their bowels and there is fecal matter on there and you just didn't catch it on the scout. All the arrows on here are not pointing to growths or masses or cancers. That's actually fecal matter. So that's one of the big importance of cleansing the bowels before having this exam done.